Okay, first of all, you should know that the fetal posterior cerebral artery, it arises from internal carotid artery instead of basilar system. Okay, second thing, posterior communicating artery infundibulum is most commonly present at the site of origin of posterior communicating artery, okay, from the internal carotid artery. I am repeating, the posterior communicating artery infundibulum is present most commonly at the site of origin of posterior communicating artery from internal carotid artery. Next, the most common example of persistent carotid vertebrobasilar anastomosis is persistent trigeminal artery. Also, it is the most cephalic vertebrobasilar anastomosis. Second most common example of persistent carotid vertebrobasilar anastomosis is persistent hypoglossal artery. Okay. Next, you should know that protolental intersegmental artery arises from bifurcation of common carotid artery. Okay. After that, it can also arise from external carotid artery or internal carotid artery at the level of C2 to C4. Okay, then it joins the vertebral artery and enters foramen magnum. Okay, now some normal variants in skull base. These are persistent stapedial artery, aberrant internal carotid artery, and the hypoplasia or the agenesis of internal carotid artery. Okay, then you should know that what is a fenestration. Fenestration is the division of lumen of artery. Fenestration is the division of lumen of artery into two separate channels, each having its own endothelial and muscularis layers. Although adventitia can be shared, like it is like this. Okay. Within the artery, there is a presence of lumen. Okay. So it is most commonly in the vertebrobasilar system followed by carotid system. Next is duplication. Duplication means two distinct arteries with separate origins and no distal convergence of these arteries. Next point you should know is that basilar artery is formed at 5th week of gestation. How the basilar artery is formed? By the joining of two vertebral arteries. Okay, next is azygous or the azygous anterior cerebral artery. It is the persistent embryonic median artery of corpus callosum. Okay, it can be associated with holoprosencephaly or the aneurysm formation. Next is median callosal artery. I'm repeating, azygous anterior cerebral artery is a persistent median callosal artery or the persistent embryonic median artery of corpus callosum. It can be associated with holoprosencephaly or the aneurysm formation. Accessory middle cerebral artery arises from anterior cerebral artery, whereas duplicated middle cerebral artery arises from distal part of internal carotid artery. Recurrent Huguenot's artery is a branch of anterior cerebral artery, which is a branch of internal carotid artery, whereas anterior choroidal artery is a branch of anterior cerebral artery. Whereas नहीं दोनों both anterior choroidal artery, but नहीं इसको एक बार काटो, ये कंप्लीट कवर कर पाएंगे. You just need to remember that recurrent Huguenot's artery is a branch of anterior cerebral artery.